Question 1. What is the primary motion at the atlanto-occipital (OA) joint? A. Rotation. B. Flexion/extension. C. Lateral flexion. D. Compression. Answer: B. Flexion/extension. Question 2. Which ligament is most associated with preventing anterior displacement of the atlas? A. Hyaline ligament. B. Posterior longitudinal ligament. C. Transverse ligament. D. Ligamentum flavum. Answer: C. Transverse ligament. Question 3. Which muscle is responsible for ipsilateral lateral flexion and contralateral rotation of the neck? A. Splenius capitis. B. Trapezius. C. Sternocleidomastoid. D. Levator scapulae. Answer: C. Sternocleidomastoid. And 4. What is the most common symptom associated with head and neck cancers? A. Persistent sore throat. B. Neck pain. C. Difficulty swallowing. D. Ringing in the ears. Answer: B. Neck pain. Question 5. Which tool is most commonly used to measure disability in patients with neck pain? A. Visual analog scale, VAS. B. Neck Disability Index, NDI. C. McGill Pain Questionnaire. D. Pain Catastrophizing Scale, PISAS. Answer: B. Neck Disability Index, NDI. Question 6. What is the main function of the deep neck flexors? A. Extension of the cervical spine. B. Flexion and stabilization of the head. C. Lateral flexion of the cervical spine. D. Rotation of the cervical spine. Answer: B. Flexion and stabilization of the head. Question 7. Which test is used to assess the integrity of the transverse ligament? A. Sharp-Purser test. B. Euler ligament test. C. Sperling's test. D. Valsalva maneuver. Answer: A. Sharp-Purser test. Question 8. Which risk factor is not associated with developing chronic neck pain? A. High pain intensity. B. Female sex. C. Low job demands. D. Prior history of neck pain. Answer: C. Low job demands. Question 9. What is the primary motion of the atlantoaxial AA joint? A. Flexion/extension. B. Lateral flexion. C. Rotation. D. Compression. Answer: C. Rotation. Question 10. Which muscle group is primarily involved in head extension? A. Anterior scaling muscles. B. Deep suboccipital muscles. C. Sternocleidomastoid muscles. D. Posterior scaling muscles. Answer: B. Deep suboccipital muscles. Question 11. Which condition is characterized by the presence of osteoarthritic changes in the uncovertebral joints? A. Cervical myelopathy. B. Cervical radiculopathy. C. Cervical disc herniation. D. Cervical spondylosis. Answer: D. Cervical spondylosis. Question 12. What is the recommended tool for screening depression in patients with neck pain? A. PHQ-2. B. FABT. C. PCES. D. AZAR. Answer: A. PHQ-2. Question 13. Which artery supplies blood to the brain and is a branch of the common carotid artery? A. External carotid artery. B. Vertebral artery. C. Internal carotid artery. D. Subclavian artery. Answer: C. Internal carotid artery. Question 14. Which physical finding is most indicative of vertebrobasilar artery dissection? A. Facial palsy. B. Unsteadiness and ataxia. C. Upper limb weakness. D. Ptosis. Answer: B. Unsteadiness and ataxia. Question 15. What is the primary function of the nuchal ligament in the cervical spine? A. Limiting cervical rotation. B. Providing attachment for muscles. C. Stabilizing the atlantoaxial joint. D. Preventing anterior displacement of the atlas. Answer: B. Providing attachment for muscles. Question 16. Which patient-reported outcome measure assesses the psychological impact of traumatic events? A. FAPT. B. PIECES. C. EISR. D. NDI. Answer: C. EISR. Question 17. What is a key feature of cervical vertebrae that distinguishes them from thoracic and lumbar vertebrae? A. Larger vertebral body. B. Presence of transverse foramen. C. Absence of spinous processes. D. Lack of intervertebral discs. Answer: B. Presence of transverse foramen. Question 18. Which test is primarily used to assess for cervical radiculopathy? A. Sperling's test. B. Sharp-Purser test. C. Alar ligament test. D. Valsalva maneuver. Answer: A. Sperling's test. Question 19. Which of the following is not a risk factor for vascular pathologies of the neck? A. Hyperlipidemia. B. Recent trauma. C. Smoking history. D. Low blood pressure. Answer: D. Low blood pressure. Question 20. What is the primary purpose of the alar ligaments? A. Limit cervical flexion. B. Limit cervical rotation. C. Prevent anterior displacement of the atlas. D. Provide attachment for muscle. Answer: B. Limit cervical rotation.